dive on female health. What is it about PMS, menopause, low libido, hot flashes, all that stuff? So, we work on a lot of patients that have different female symptoms. They might come in and they have PMS, which is premenstrual syndrome. Syndromes are not normal. They might have really horrible periods and cramps and get turned into emotional crazy people around their cycle. They may suffer from breast tenderness, hormonal imbalance, where they're getting acne, where they are gaining weight, where they're getting bloated. They may have cramping, heavy periods, light periods, skip periods. All those are female health issues. A little bit later into the female health journey, they may have menopausal symptoms. Menopause is normal. Menopause means menses stop, but it does not mean you should have hot flashes or low libido or dryness or anything, right? You shouldn't have that. It just means your period stops. That's it. That's menopause. Period stops. That's it. And fertility cases. And so we're seeing more and more. I'm almost been in practice in Central Florida for 20 years. And we're seeing more and more women having difficulty having babies. Some of that difficulty is because there's more and more pollutants in our environment, chemicals in the water that we drink, in the air that we breathe, and the food that we eat. Heavy metal toxicity. You can get arsenic, so that's a heavy metal. You can get arsenic from eating rice. You can get it from eggs. You can get it from chicken. Could be in your water supply, which is crazy, right? So let me know, guys, if you can hear me okay. If you're on with me, let me know. Hi, Tiffany. Good to see you guys. You can have hormonal imbalances. So let me back up a little bit. Patients come into the office. A lot of times patients come into the office because we're their last hope. So you guys, if you're on, you can say if we were your last hope. And they come in, and a lot of times they've been given medications and prescribed medications. And yes, the insurance company covers the medications. And so they're like, well, was my insurance cover what you guys do? No, your insurance policy is a sickness policy. Your insurance policy is there, my belief, if something drastic happens, like you chop off your arm cutting down a tree or something crazy. That's what your insurance policy for. Your insurance policy there is not there for health. It's not there for wellness. It's not there to teach you how to cook healthy food for your family or identify things in your environment that may be making you sick. That's what we do, is we look for those things, right? And so I get very frustrated that I have a lot of women come in, and it seems like a certain age, usually in their 40s and 50s, their doc says, hey, it looks like your hormones are decreasing and we should put you on bioidentical hormones. Bioidentical hormones does not mean, it has such a false, horrible name. It doesn't mean that you're getting like pure, natural, beautiful hormones that your body makes. It means that you're taking a chemical that came from a pharmaceutical company and you're putting that in your body. And you may have better libido. And maybe it decreases your hot flashes, but did it fix the cause of the problem? Did it fix why that happened in the first place? For us in the office here located in Central Florida, our office is called Palm Natural Health. I'm the head physician at Palm Natural Health. And when we look at a patient's case, we look at what is the cause of the problem. So, for example, if someone's suffering from premenstrual syndrome, which a lot of you guys think is normal, right? Like, oh, it's my normal period. I have cramps and, I have to like stay in a dark room and I just can lay down because I feel like I'm bleeding to death. And that's my normal period. I'm like, that's not a normal period. How do you even function? And ladies, you guys are so tough that you could be like bleeding to death, have a migraine, have cramps from hell, and still somehow cook dinner, do the laundry, and help your kid with your homework. I don't know how we do it. Like, that's crazy. I don't know how you do it. You're not supposed to have that. You're not supposed to have cramps. You're not supposed to have heavy periods. You're not supposed to have breast tenderness. You're not supposed to turn into emotional nightmare. You're not supposed to have that. Menstruation is just shedding, not shredding, shedding of the uterine wall, right? To get ready for, okay, well, we built up this uterine wall to conceive. And if you don't conceive, then the body's like, all right, we don't need that one. Let's break it down like a construction project and build it back up, right? So that's the point of having a cycle. It's in preparation of being pregnant. It's not to make you miserable or make you feel horrible or make you have cramps or anything like that. But unfortunately, there's so much misinformation out there for girls and young women and moms and women. We don't talk about these things. So that's why it's so important that you guys are on. And I want to acknowledge you for being here. So hi, Tiffany. Hi, Cindy. Hi, Sarah. Hi, Terry. Thank you for letting me know you can hear me. Hi, Terry. Glad you can make it. Hi, Darcy. Hi, Heather. And so it's super, super important for us to understand that natural healthcare and normal function is not cramping and bloating and bleeding to death. Normal function is shedding the wall. How does the wall come out? Not to be graphic, comes out the vaginal opening in the form of blood and maybe little tiny, tiny pieces of tissue. You bleed for 3 to 5 days and then it's done. Like the process is done. It's not any of those other symptoms. And if you have any of those other symptoms, my biased opinion is not the addition of hormones, because a hormone such as estrogen has side effects. A hormone such as testosterone has side effects. And a hormone such as progesterone has side effects, right? Some have more than others. Increased estrogen in a female body has been shown to lead to cancers. Oftentimes younger women come into the office in their teens. I've seen as early as 13 to in their 20s, and they're put on birth control because they have acne, because they have bad periods, because they have bad cramping, and they're told by their medical doctor. And actually there's a documentary out on this. Those of you that are local to Central Florida, we're going to be in Kissimmee on June 20th. I'm watching this documentary. And it's about birth control, and it's about all the things that women are not told. And I'll put the clip up after this, but it's about all the not the full disclosure of when someone's put on birth control. And so I'll get a patient in their late 20s or their 30s, and then now they want to have kids, and they're having difficulty conceiving because they've been on birth control for decades. And they were never told, hey, well, this birth control is really convenient. If you're using it for what it's supposedly for, it's very convenient, right? Like it seems like I don't know, like a very convenient thing to do if you're looking for not getting pregnant. But it comes with a price, right? The convenience comes with a price. And that price that you pay later in your 20s or your 30s when you're trying to have a family, is it worth it? So sometimes I wish I could go to that 21-year-old and be like, look, I might not be interested in having a family now, but you've been on birth control for years already. And the more years you're on birth control, the less likely you are to conceive. The increased risks of cancer, the increased risks of cervical cancer, the increased risks of breast cancer. Extra estrogen in the body leads to cancers. Right? And then, by the way, if you're putting hormones in and your body's already making hormones, you're now imbalancing your hormones. And so they tell women who aren't been on birth control, and I was on birth control, they tell women, hey, when you come off that, you might have a rough time. You might have increased bleeding. You might have spotting. You might have cramping. Why? Because you've been forcing your cycle, which is a natural process. You were forcing it in a chemically induced way to go a certain way. And now you're asking it to just kind of kick back up like it's some kind of factory machine, right? And so early in my 20s, I had actually, from the time I had my period, I think I got my period when I was 13 on a family vacation in the Bahamas. That's a horrible time to get your period, right? It's like, you're on vacation, you want to be in a bathing suit, and you get your period and you think you're bleeding to death. You're not bleeding to death. It's a normal cycle, but it's kind of scarring as a 13-year-old, right? So then as a track and soccer athlete, they diagnosed me with irregular cycles due to being an athlete. It doesn't matter if you're an athlete. You should have normal cycles. That was the excuse that I was told. And so I would have a period and skip 3 months, and have a period and skip 6 months, and have a period and skip I think the longest I went was 9 months. And it was kind of great because who wants to have a period? That's not good. But was that healthy for me? I went to an OBGYN and I said, look, I'm really concerned. I keep skipping periods. And she goes, well, you're a soccer player, right? I'm like, well, yeah. And she goes, you've been playing, every season for a long time. And I'm like, yeah. And you run a lot. Well, yeah. Well, that's why you don't get your period. I'm like, yeah, but in the future, I want to have a family and I have regular periods. So what's the cause? Oh, you're a soccer player. That's why. That is a horrible reason why. All right. So if a doctor tells you it's because you're an athlete, or because you are getting older, or because you're female, or because you have babies and that's why you have a symptom, I do not like those reasons. Everything has a cause. And so way back then, a couple years ago, way back when, it was found out when my periods got really bad and my hair started falling out and I gained 50 pounds and I was miserable. It was found out through a holistic nutrition testing, which we've now developed and improved and done remotely, called now we're doing quantum nutrition testing. It was found that I had mercury in my pituitary gland. Well, how would mercury get in my pituitary gland? I didn't inject something in my head, right? How do you get mercury in a gland in your brain? How does that happen? Well, you can ingest it, right? So foods with high fructose corn syrup can have mercury. I'm from South Florida. We spent many weekends on the ocean, fishing and getting lobster and that kind of stuff. So eating seafood, you could get mercury. My mom's a registered nurse, and when I was born, you vaccinated your kid, and I got vaccinated. So what was the cause of the high mercury in my pituitary gland? You can get it from water. There's legal levels of water, which is really interesting because there's permissible levels of mercury in your water supply. You can look it up. You don't have to believe me. You can go to ewg.org. You can look up the tap water reference. I couldn't put that in there. ewg.org, and you can look up your water supply and see. And so there's safe levels of mercury in your water that you can drink. And there's safe levels of chlorine, and there's safe levels of all these different chemicals. However, you can ingest a certain level and they consider it safe, which I disagree. I think they just can't get it out of there. I don't think there's a safe level. And yet your newborn baby can be injected with higher levels. So when you eat it, it has to go through your digestive tract. It gets filtered. Your liver filters it. Your kidneys filter it. You have a blood-brain barrier to try to keep metals out. But when you get injected with a metal, it just bypasses everything. And so between the vaccines I received as a kid, the mercury I ate in food, the mercury I drank in water, I had high levels of mercury in my pituitary gland, which was negatively affecting my endocrine system. Your endocrine system is your pituitary gland. It could be part in your brain called the hypothalamus, the gland right here in your neck called the thyroid gland. If you're female, it's your ovaries. If you're male, it's your testicles, and then your adrenals above your kidneys deal with stress. And so it's negatively affecting my system. So way back then, a couple years ago, the way Joanne said, you're wasting my time. You're an athlete, you're healthy, you look good. There's no tests that we can run. There's no medication we can give you other than birth control. And so why don't you come back when you have a real problem? That's what she told me. She told me I was wasting her time. I never went back to the OB again. It was a horrible communication from a patient standpoint to a doctor standpoint. It was just an awful thing to tell someone, right? So I felt pretty hopeless. And actually, when I met my husband, Dr. Jason Dean, when I met him, in the back of my brain, I was really worried. I'm like, this guy wants to have kids and I want to have kids, but will he still love me if I can't have a family? Will he still love me if we can't have babies? Will he still love me if that can't happen because my pituitary gland's messed up because I had mercury in my system? And so luckily for both of us, I was able to detox the mercury, not from chelation, but from a whole food supplement, which did it very gently in a very specific way with very specific minerals. And the mercury detox out of my pituitary gland also supported my pituitary gland, didn't cut it out. supported it, and 50 pounds melted off me. My periods became very regular. My periods are very regular. Don't have PMS symptoms, don't have menopausal symptoms, don't have any kind of female, what they would call female symptoms, right? I don't cramp when I have my period. I can work like no big deal. I mean, the only change is that I'm shedding uterine lining, right? And that is because of all the nutrition work that I've done. Did I have to change my diet? Yeah, I totally did. I was known to have ice cream for breakfast. Why? Because it sounds good. I was known to have leftover pizza. I was known to eat lots of pizza. I was known to drink Long Islands, and so I had certain habits as an athlete that I thought as long as I looked good on the outside, it didn't matter what I ate. If you look at men's fitness magazines or women's fitness magazines, how do they define health? They define health by, you see the female on the cover and she's in a sports bra and she's got a six pack and her legs are defined and she has no cellulite and she's not overweight. And that's how most people define health. That doesn't mean that person's healthy. She could be toxic as hell. She could be infertile. She just looks good. So how you look and how you feel is not the definition of health. Health truly is 100% of your organs and 100% of your glands working optimally. It means that you have decreased your toxic chemical load and you decreased your metal load and you decreased your bug load and you're taking steps to move in the right direction. Some people think, oh, well, Dr. Palmer, you did your nutrition back then and now you do nothing. I'm like, yeah, right. You should see my house, right? Like, right next to me, I have supplements in the kitchen. I have supplements in the bathroom. I have supplements in my nightstand. I have supplements. You basically can go in any room in my house, look at my purse, look at my car, look at my office desk, and there are supplements. Why? Because our food, our soil is depleted in minerals, and our planet is crazy toxic and crazy filled with bugs. And you can inhale these bugs, you can eat the bugs, you can walk on the bugs, you can get injected with bugs, and we have work to do. Okay. So I want to just let you know that female health or male health, if you have symptoms, it is not in your head. It does not mean that you are crazy. It does not mean that you are lazy. It means that something is imbalanced in the body. You can suppress that imbalance with a medication. Every single medication has a side effect. So I will go, I have patients that come in and they bring me medications, and there's thousands of medications, right? And I go to that website, drugs.com. I go to the website and I look up their medications. One, because I want to make sure I understand how it affects in a negative way the body. Two, I want to make sure that they're not on duplicate medications, because a lot of times people are on duplicates because the docs aren't talking. And three, I want to look up the side effect list and I want to see, is the patient complaining of headaches or migraines or ulcers or stomach pain or insomnia or anxiety? Is that a side effect? Is that a reported side effect of the medication? If you're currently on medications, I'm not telling you to stop. Please don't do that. That could be very harmful to you. But go to drugs.com. Anybody can go to drugs.com. It's a free site. Look up your medication. Look at the side effect. Are you experiencing any of those side effects? And if you are, we want to find the cause of the problem. And really, there's not 20 million causes. There's pretty much standard causes that we look for every day, every case, right? We look to see if something that the patient is consuming has a negative effect on their body, some kind of food, right? This week, I found a couple people reacting badly to corn. Why? Because corn's genetically modified. And that's a whole other seminar. It could be that you have a chemical toxicity, right? So I found pesticides on some patients this week. It could be a heavy metal toxicity. I found arsenic on some patients this week. It could be that you got exposed to too much radiation. So I found multiple cases of radiation this week. It could be that your bugs are having a party, right? So you could have a parasitic infestation, I guess is a good word, and you have too many bad bugs, right? So if you take antibiotics, if you've had any rounds of antibiotics, it kills what? It kills your good bacteria and it kills your bad bacteria. If it's a life or death situation or a major infection, good, you survived. But if you kill your good bugs, your gut's going to be compromised. What does that look like? Well, it looks like acne. It could look like psoriasis. It could look like stomach pain. It could look like bloating. It could look like nausea. It could look like weight gain. I mean, antibiotics could like really damage you. So does that mean you just take probiotics and that's your fix? No, because when you took the antibiotics, maybe your parasites went crazy. Maybe you have a chemical toxicity. Maybe you have a heavy metal toxicity. Other things that we look for, maybe it's stress. So many people are stressed, right? I blink and it's Thursday. I'm like, how is it Thursday already? Like I would just felt like it was Monday. Anybody else feel like holy Toledo? How did it become Thursday? And so stress negatively affects the body. It burns up your B vitamins. It burns up your minerals. It puts stresses on the adrenal glands. A very, very common chain of events is someone has stress, right? So they have a stressful job. Their adrenals kick in. The adrenals are glands above the kidneys. They kick in. They secrete stress hormone. Your system goes into fight or flight, right? You have the person that's like, la, 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 like super hyper. Then the adrenals are just starting to wear out. So maybe the person feels dizzy. Maybe they have back pain. Maybe they go to bend over and pick up a sock off the floor and they're like, whoa, I'm dizzy. Maybe they feel fatigued. Maybe they feel tired but wired. So they try to go to bed and then they're up all night, like scrolling on their phone. And then those adrenals become so compromised, they ask for help in the rest of the endocrine system. Now they're asking the thyroid for help. So the thyroid can do one of two things or both. The thyroid can speed up, right? So it's really cool when your thyroid speeds up. It's happened to me. You can get so much stuff done, right? You can clean the house. So while you're cleaning the house, you're doing laundry, working on something on the computer, answering an email, answering a text, handling the dog, handling your kid, handling your husband. Like you're just like running here and there, right? And you can get all this stuff done, which is super cool. Well, it's bad because you can't stay in that state. The thyroid gets tired. And when the thyroid gets tired, then it starts to lean on the heart. And then the heart starts to race. And then the heart gets fatigued. And if the heart gets too fatigued, you die, right? It just gives out. You die. Or the thyroid goes really slow to try to get you to rest. That's why it happens. If you think about it, thyroid goes really fast. It's kind of like you're spinning your tires, you're burning your motor. And then your thyroid goes slow and it says, dude, can you please rest? You're killing me. And now you're tired and you hit snooze and you can't get up in the morning. It's because your thyroid needs to repair. You get puffy, you gain weight, you slow down, your hair might change, right? So, thyroid. If you have imbalances in your thyroid, if you have imbalances in your adrenals, if you have imbalances in your pituitary gland, you are going to have symptoms, hormonal symptoms. What do they look like? They might look like cramps from hell. You shouldn't have cramps from hell. It may look like you're really bloated. It may look like you gained 15 pounds and no matter what you do, you can't get rid of it. It may look like, oh my gosh, the worst hot flash turns on. You feel like you're dripping in sweat. It's embarrassing because now you need a new shirt and you're drenched, right? So you do not have to suffer with these things. There is hope for you. We can help you with that. So let me go. I know I missed some questions. Let me answer some questions and then we'll keep running. Let's see. So Alyssa says, I was stunned when I first learned all of this from you about PMS symptoms. Yeah, we're taught PMS symptoms are like, that's just what happens, right? And it's totally a lie. It's totally not true. Midol wants you to think, the drug Midol wants you to think that that's what you take. And I meet some female patients, they take Midol all the time on their cycle. I'm like, Midol has a side effect. Actually, you know what? Let's look up what the side effect of Midol is. Because I don't, I want to tell you, I don't know all the side effects of Midol. So people think Midol or Tylenol or ibuprofen and all that stuff, they think that it is because it's over the counter. They think it's cool, right? So Midol actually has, I didn't know this, Midol actually has, because we don't study pharmaceuticals in chiropractic school. Midol has acetaminophen, it has caffeine, and it has pearlamine. Okay. So then what are the side effects? It says avoid driving and doing other tasks or actions that call for you to be alert. What? Do not take Midol for longer than you were told by your doctor. I don't know how many doctors tell you to take Midol. Avoid taking other products that may have acetaminophen in it. Too much may cause liver problems. Liver problems have happened with acetaminophen, and sometimes this has led to a liver transplant or death. Okay, this is on the product line. So if you don't believe me, go to drugs.com, look up Midol. Follow the directions. Don't take more than you should. Avoid drinking alcohol. Limit your use of caffeine. So this is stuff that people don't think of since there's caffeine in Midol. If you're drinking tea, and a lot of women are drinking tea, coffee, or soda, it can make you feel nervous, shaky, and have a fast heartbeat. Let's see. So side effects: hives, rash, red swollen, peeling skin, wheezing, tightness in the chest, trouble breathing, trouble swallowing, trouble talking, unusual hoarseness, swelling of the mouth, face, lips, tongue. So those allergic reactions, those are bad. Signs of liver problems like dark urine, feeling tired, not hungry, upset stomach or stomach pain, light colored stool, throwing up, or yellowing of the skin or eyes. So the liver starts to fail, right? A very bad skin reaction, Steven-Johnson syndrome, may happen. It can cause very bad health problems that may not go away. Sometimes death. They say sometimes death, like a side note, sometimes death. From Midol, guys, from Midol. Get help right away if you have signs like red, swollen, blistered, or peeling skin, red or irritated eyes, sores in your mouth, nose, or eyes. Can make you feel sleepy, can make you nervous. So, wow, that is very interesting. How many of you guys knew that? How many of you guys take Midol? You know, I think a lot of people view over-the-counter medications as like no big deal. It's no big deal. We just, take my Midol. That's crazy. Shannon says, got to see the business of birth. So the business of being born, I think, is the name of the film by Ricky Lake. Yep, you should totally watch that. Are pap smears necessary? Thank you for speaking on this. Like you said, this is not talked about enough. I have always thought my menstrual migraines, cramps, mood swings were all normal. No, those are not normal. A gynecologist tried to put me on estrogen patches to solve my migraines and cramps. Palmer Natural Health has actually helped me to heal the cause of these symptoms. Good job, Christina. That's awesome. I'm scared to go back to my OBGYN after everything I know. How can I keep up my female health without going to a regular doctor? So it just depends on your history. So if you have a family history of cervical cancer or breast cancer, then, maybe you should get checked. If you've had irregular PAPs, maybe you should get checked. Do I recommend pap smears? I am not an OBGYN specialist, so I am not privileged to answer that question. But I don't really love the idea of poking holes in people, right? So we're gonna do a pap smear. We're gonna poke holes in the cervix and see what's happening. To me, I would rather do whatever I can naturally to improve female health, right? So we know that chlorine in a vagina would be bad, right? If I said it like that, you would be like, yeah, it's going to be bad. So what do I mean by that? Bleached tampons are not good for you, right? Certain spermicides have really nasty chemicals like propylene glycol. Anything you put in your vagina, it absorbs. IUDs, awful. I've had cases where someone puts in an intrauterine device and they have stomach cramping, they have kidney failure, they have liver failure, they have severe abdominal pains, they have fertility issues. I had a case probably 10 years ago where the patient was in a car accident and I see this weird thing above in front of the spine. It was the IUD. So the body, the uterus did not want the IUD in it. It pushed it out of the uterus and into it was just kind of floating around the body. I'm like, oh my goodness. My mom told me a story of a lady who got pregnant and she had IUD. The baby was born holding the IUD. That's crazy. That is crazy. What foods are good for women's hormones? So that is a great question. The easier question are what foods are bad for female hormones. So too much sugar consumption will imbalance your hormones. Too much alcohol will imbalance your hormones. Soy is a phytoestrogen, plant-based estrogen. So this fake mystery meat, this Wonder Burgers or whatever they're called, Bad news for men and women. So they're saying, oh, be plant-based, so support the world, support the planet. No, GMO soy is not good for the planet. I was talking to a farmer today, and they spray GMO soy with Roundup, right? They're Roundup ready crops. So spraying glyphosate is not good. It's one of the reasons why Monsanto was sued for what, billions of dollars, because it's been linked to cancers. And so soy would be a very bad food to imbalance hormones. Um, non grass fed meats that have hormones like growth hormone would not be good to eat. So I guess to answer your question, because some people get depressed when I tell you not to eat. So what should you eat? You should have grass fed meat. I love when women can have uh, pure liver, like Braunschweiger or liverwurst, high quality proteins like free range eggs and grass fed meat, and game, your game animals like deer that have foraged on in the forest. Your fatty meats like salmon, like wild salmon, not GMO salmon. Vegetables, I'm cool with vegetables. I'm cool with fruit. Yeah. So the closer to nature you eat, the better for your body. The more processed you eat, the more imbalances that are going to occur. The worse you eat, so high consumption of sugar, cookies, candies, ice cream, alcohol, chocolate, drinks, you're going to imbalance your hormones and you're going to have a really rough period. All right, Jamie says, just talk with Dr. Dean this evening and learn it's not normal to always be tired. No, it is not normal to always be tired, right? If you are tired, there is a cause. It could be your adrenals. It could be your thyroid. It could be your heart. It could be you're not really sleeping well because you have parasites. So many reasons why. I assumed it was just because I was the mom of two little ones, interested to say what he has to say next appointment. Yeah, Jamie. So you're the mom of two little ones. You're busy, but being busy doesn't make you tired. Working doesn't make you tired. If you leave your office and you get home and you're exhausted and you can't move, one of two things. One, there's an imbalance in your body. We need to find it. We need to fix it. Or two, you hate your job. You're like in the grind, which you should watch my live from yesterday on my personal page. And you're just like, it's sucking your soul. And that would make you exhausted. And no supplement or caffeine in the world will ever fix that. So if you're living your purpose and you love what you do, but you're still tired, you want to look to see, or you need our help to quantum test to see if there's any imbalances in the body. And then instead of suppressing those imbalances with the medication, we're going to figure out the exact right supplementation to give the proper nutrients and vitamins and minerals and herbs to rebalance the body, to repair the body so the body can function optimally, and then your body functions optimally. Some people were asking me last weekend, I worked all week, I saw patients all week, did owner stuff all week. And then I taught all day Friday, all day Saturday. We were out with colleagues till around 10 o'clock at night. And people were like, aren't you exhausted? I'm like, no, I feel amazing. But I was on my feet all day and I worked all week and I was really busy and had all these things happening. How come I wasn't exhausted? I wasn't exhausted because I was serving my purpose. I wasn't exhausted because I was taking my supplements. I wasn't exhausted because I was eating as healthy as I could and sleeping, going to bed at a decent hour, right? So if you're exhausted, look to see, are you doing something that you're miserable and you hate? If you're miserable and you hate your job, don't do it. Do something else. If you have imbalances in your body, call the office and we're happy to help you. We're happy to do a consult on you, whether you're local in Florida or you live somewhere else, you live in a different country. We're happy to do a consult. And what that looks like is we send you paperwork and the questions are going to ask you about female health. The questions are going to ask you about your periods. The questions are going to ask you about your pregnancies. If you're exposed to mold or heavy metals or asbestos, or if you smoke or drink or whatever, it's going to ask you about your past surgeries. It's going to ask you, what are your current symptoms? Then we're going to get on the phone with you, or you're going to come in the office, and for about 30 minutes, we're going to dig even deeper and gather more data, gather more information. Were you sick during your pregnancies? Did you have a C-section? Was a vaginal birth? How are you now? How's your energy levels now? What are you feeling now? What symptoms do you have now? We're going to take that data. We're going to quantum test the data, quantum nutrition test the data to find the exact cause of your problems. It could be that your thyroid is exhausted. It's looking like it's fine on the blood work. Your doc says, hey, your thyroid's in range. You're fine. We don't know why you're tired. Maybe you're crazy. Okay. So if a doc tells you you're crazy, it means that you have a symptom and they can't figure it out. It does not mean you're crazy. And no one ever came into the office saying, I feel tired. I'm so happy. No one's ever done that, right? Usually it's like, oh my gosh, I'm tired. I'm sad that I can't play with my kids. Or my kids want to go for a bike ride. And I'm like, yeah, right. That's not happening. I can't even get to the garage. Or you want to hit snooze 15 million times because you're exhausted, right? So we look for the cause. We look for the exact right thing that we should work on first. We look for the exact right supplementation. We make sure that the person can digest that. We make sure that the person is not allergic to it or sensitive to it. We find the exact right dose. We help you with your food. We hold your hand. We support you every single week through your program and get you where you need to go. And people have had amazing, amazing results. So if you have horrible PMS, or you have bloating, or you have any symptom, you have hot flashes, you're super tired, there's a cause and we want to help find it. All right. So for me, I stopped taking oral birth control because it didn't work. It didn't work. I took it for a month. I gained 20 pounds. 20 pounds. That stunk in my early 20s. And my boobs increased the whole size. And I was like, what the heck happened to me? And then I felt like a crazy psycho emotional person. I like felt like I wasn't me. And I stopped immediately. Right. So I can't tell you to just stop taking your birth control or just stop taking any hormone. Please do not do that. But if you work with us and we can get your body working better and we can balance out your system, it may be possible that you don't need as much hormones. It may be possible that your medical doctor says, hey, you don't really need this anymore. It may be possible that we balance out your body without the side effects of medications. So Lisa's asking me like what kind of birth control should you use, right? So that really depends on where you are in your life. Are you, in your 20s and you're in the dating scene? Are you married? Are you trying to conceive? Are you in your later years? Like where are you? Are you in a serious relationship? Are you just dating someone? Are you not in the dating scene, but you want to be in the dating scene? So, I'm not saying that I need all your personal information, but I need more data. So let's say that you're in your 20s and you're definitely in the dating scene. I would say the barrier method is what I would recommend, condoms, right? Now, some of you guys are going to say, but I don't like condoms. I don't like them. I don't like anything about them. And I get it. I totally understand, but it's a barrier. You do not want to have a risk of sexually transmitted disease, HIV, and you definitely don't want a COVID vaccinated person to share their genetically changed material with you in a very bad way. Okay. We should probably have like a ladies invite. Maybe Aaron, I know Aaron's on here. Maybe we have our tea party, which is ladies only, and we dig deep into these questions and we can show solutions. We can show our favorite condoms. We can show our favorite, I don't know, we'll just have like a ladies tea night or tea afternoon. And those of you that don't live in Florida, we can stream it and it'll be like a Zoom ladies only. So you have to let me know if you like that. If you are older and you're married, you could do the timing method where you track your ovulation, and at certain times you definitely don't have unprotected sex because you're more likely to get pregnant. You could do that. That's not foolproof. None of these methods are foolproof, so don't get mad at me if you get pregnant, right? Just so you know, the newer people on here, some of you guys think you can't get pregnant. So you've been having unprotected sex, and then you're going to be on our program, and you should totally know that since we're going to help your body heal naturally, that now you can get pregnant, and you can't get mad at us when you have your second, third, fourth kid. So that's your warning. If you're older, some kind of barrier method. Some people like what's it called? The thing you put in the vagina? I can't think of it now. What is it called? What is it called? Help me. What is it called? So the thing that you put in your vagina, man, don't make me look it up. I'm gonna look it up. What is that called? Hopefully you guys posted because I'm not finding the word I'm looking for. Diaphragm. Thank you. Diaphragm. Yep. So you can use a diaphragm. You want it fitted for you. So gets inserted into the vagina. Thank you guys. It gets inserted in the vagina and it covers the cervix. So it's a barrier for sperm. I do not recommend, Danielle, I do not recommend the IUD. The IUD is either copper or plastic, and copper is your body will negatively affect and absorb those metals. Okay, so Aaron says that'd be great. Michelle says that would be great. Michelle, I'm not sure what you guys use for 10 years. Oh, so she did the track your cycle. So we definitely can talk about all this good stuff. I might even invite some midwives and some natural professionals to join in the conversation, or medical professionals too. We have some medical professionals that are more holistic that could be interesting at our tea parties. So that could be really cool. So you guys have to let me know if you want that. So if you need our help, if you are suffering, if your kid is suffering, if your sister is suffering, if your aunt is suffering and you need our help, please reach out. The office number Aaron will post is 407-682-8444. We have a June special. So normally a consult in the office is $250. For June, we're doing a $144 special. And that includes your consult, that includes your quantum nutrition testing, that includes a second visit where you do a report with a personalized program on what we found, our supplement recommendations, and how the program works and what it costs. So if you're interested in that, reach out to Erin. You can private message her and say, hey, I was on Dr. Palmer's live and I qualify for the 144 special. You should totally say that, okay? All right, good. So you guys can ask questions. I wanted to show you, so we're trying to educate on recipes. So let me see if I can share my screen with this program. I realize now that Zoom has a share screen button, but this is a different program and I don't see share screen button on this one, which is hilarious. That's funny. Okay. So what I wanted to share with you guys is a recipe. So in our office, we have a recipe book and we have different recipes. I'm a foodie. We have different recipes that taste good. So this recipe Aaron posted in the comments, it's called the not so cheesy lasagna. And so because some people react badly to dairy, right? Some people will be more congested. Some people have hormonal issues when they eat dairy. So this is a recipe that uses cashews as the cheese. Now, since this recipe was developed, there's a lot of non-dairy cheese options. Some of them are great, some of them not so great. But basically, I love this recipe because the lasagna noodles are not made out of bleached white flour, which is not good for you. It is made out of zucchini. So you cut the zucchini lengthwise and you place it into a baking Pyrex dish. And you can put a layer of marinara. You can put a layer of ricotta, like ricotta cheese. If you're not doing dairy, you can put a layer of grind up cashew, or you could put some of the almond-based cheeses. You could try that. I don't really like soy-based cheeses. Some people that react to dairy as far as cow dairy do well on sheep. So you can try sheep cheese. It has fresh basil. Anytime you add fresh herbs to a dish, it really elevates it. And so basically you're going to wash all the produce. Try to wash it in filtered water, because if you buy organic and you wash it in city water, you just contaminated your organic food. And if you wanted to make the cashew cheese, you're going to take a cup of raw cashews. You're going to add some filtered water when you pulse it in the food processor until it becomes a paste. And then you're going to set it aside. You're going to cut the zucchini lengthwise. You can cut the tomatoes if you want. And you're basically going to layer all this stuff up. So I think it's pretty amazing. I think that it tastes really good. You put it in the oven and bake it. So it preps 20 to 30 minutes. So you can bake it so the cheese melts, or you can serve it like raw like that. So if you serve it raw, it absolutely has more nutrition in it. If you heat it up, still tastes really good. You can even get a spiralizer and spiralize noodles, so you can make spaghetti noodles like that. We really at the office enjoy sweet potato noodles. So it's a type of Asian noodle made out of sweet potatoes with no white flour, with no egg, with no preservatives. They look kind of weird there. They look like gray noodles. When you cook them, they're see through. And if you cook them and then you put them in some hot marinara sauce or some pesto or some butter, it will absorb the taste of the noodle. Oh, excuse me, it'll absorb the taste of the sauce. So good. So good. So, Aaron just popped that recipe in there. So, hopefully, that helps you, give you some ideas of what you can try for food. Because if you're bored with your food, that's not good. There's so many food options. All right, guys. Well, I thank you guys so much for joining me on this female health seminar for Palmer Natural Health. I'm Dr. Lisa Palmer, also known as Dr. Mama Bear. If we can help you with female complaints of any type, or if you have a friend or family member who is told it's all in their head and you want to find the cause, please call us. Dr. Lisa Palmer, Palmer Natural Health. Good night.